So, Jeff, can you like introduce yourself for the audience?
Sure. My name is Jeff Cubos. I am in just outside of Edmonton, Alberta, in Canada. I'm originally from Toronto, and I am a sports chiropractor.
Nice. So, um, oh, like I know that some chiropractor would practice some like will do some alignment for the body alignment or like bone alignment for athlete. So, how exactly would you see that is like how much would it help athlete perform better?
Sure. I guess I kind of think of it in a little bit of a different way. In the manner of instead of thinking about static alignment, for example. I pretty much want all the regions of the body to move as well as it could. So if you're specifically speaking about adjustments, um, for example, the goal is not so much for alignment per se. It's more, does each joint or the region have the requisite r wiggle room that it needs to have in order to function properly.
So, um, let's say if an athlete don't have like the space to like function per on one of one side, would you like after like myofascial release, would you do anything else to help it?
Yeah, so um yeah, depending on what I might think the athlete needs in terms of space, I would assess what they currently have, what I think is ideal, and then how I can try and help them achieve that ideal space, for example. Um, so I might use myofascial type of soft tissue therapy. It might be osteoarticular joint pumping, for example. Um, it could be other types of passive therapies, maybe electroacupuncture or regular acupuncture. Um, and then it might be an adjustment as well. Uh, but I would also equally categorize exercise or active strategies within the same realm. So it's not just me doing the work, it is the athlete doing the work as well, and me helping them find what is the best intervention exercise wise that they can do to help improve that space.
Cool. So, um, because I'm from Asia, we don't really have like a chiropractor. So, can you like explain to us it how is it different with like physical therapist?
Yeah. Well, I'm gonna generalize first. Maybe I might get in trouble for this. Um, but years ago, when I was in China and I was teaching over there, um, what I noticed is the joint spaces were very good. So, I would be on the street and a lot of people would be maybe waiting for the bus in a squatting position because there's no benches, right? And you know that. And then I would be um, walking along the Great Wall, and people more than two times my age are walking faster than I am and smoother than I am. And in fact, my host at the time said, "Jeff, why are you walking like a penguin?" So that really gave me an aha moment that, huh, those of us in North America, um, are really lacking relatively to other parts of the world in terms of uh, where our joints should be. Um, but to your question about chiropractic or adjustments, I'm going to stress enough that um, That's not the only thing that we can do, um, or that we do. Some people do for sure. But I think the difference between a chiropractor and a physio is really dependent on the individual professional themselves. Because you have a lot of physios that also do manipulations, and then you also have chiropractors that do exercise. So I've worked with a number of physiotherapists, osteopaths, athletic trainers, athletic therapists, massage therapists, and many times you can't even tell the difference of who's who. Um, I think maybe where where the difference can be is in the structure of our education. Um, Whereas with the physiotherapist, they might spend more time with cardiorespiratory as well, and then we might spend a little bit more time with specific manual therapies. But I think there's a lot of similarities in terms of our ability, diagnostically, intervention wise, treatment wise, and hopefully at the same time, I think the the more we're on the same page, the better off the athletes and the patients are.
Nice. So, how do you think like your role is gonna how do you think your role is going to help like a professional hockey player?
Um, so in the setting that I'm currently in, we have 8 of us professionals on our team. So we have 2 strength coaches. We have 3 athletic therapists or athletic trainers. We have a physical therapist, a massage therapist, and myself. And together, our objective is to help out the hockey players. So, myself, for example, uh, my role specifically is more on the manual therapy side, plus um, reintegration back into exercise and training. Can I myself um, run their strength and conditioning program? And well, at least an athlete, sure. But my teammates are better than I am. I mean, I have a strength and conditioning background. However, at the same time, that is their specific role. So I feel that my role is to make it a smoother transition between the treatment room and the gym, help them to move better, help them to move with integrity, and then they can do some training, even though they do a lot of rehabilitation themselves.
Nice. So, um, from hockey player, what are like the main or like some major injury you're gonna encounter?
Okay, so I'd say there are probably 2 types of injuries, not different than many other sports. Um, there's a there's the non-traumatic injuries that might happen over time, sprains, strains, tendinopathies, tendinosis, so on and so forth, low back pain, and whatnot. And then you also have your traumatic injuries, so the ones that happen in the sport. So it's a high-speed sport, lots of collisions, lots of contacts. You're probably familiar yourself a little bit, but the injuries can be one or the other. In my previous experience working with track and field for a number of years, or gymnastics, there really isn't much collision or contact injuries, right? So what I found with those athletes, it's if they get hurt, part of it at least, or a lot of it might be my fault because there's no collisions. Okay. Yes, of course, there's the training and there's lifestyle and everything else surrounding that. But at the end of the day, there's no collisions, there's no contact, it's non-traumatic. If they get hurt, then it's on me. From a hockey standpoint, um, I still view it the same way, but at the same time, when they're in a game or a practice, there's still a lot of variables that we can't control. So our job is to, as best as we can, help them be a little bit more resilient um, in terms of being able to withstand the contact, the traumatic instances, and then also resilient in terms of being able to sustain the loads that they're performing with.
So I personally work with like track and field athletes,
Yeah.
basketball, rugby before. Um so I noticed that like injury like hamstring strain are big deal in like track. But when it comes to
Yeah.
like team sport like basketball, like baseball, hamstring strain was probably easier to recover or like return to play from. So, like you mentioned, hockey is also a high speed sport. So, um, the does hamstring injury in ice hockey or in hockey is towards like sprinting or like more towards like basketball.
Um, I'd say not so much like sprinting. I think I don't have the evidence or the research for this. Um, but I think the hamstring strains in hockey are related to vault more, um, being unprepared for the volume that they're playing with, or or the spike in, or the change in volumes that they're working with, um, rather than, you know, for example, straightaway speed or acceleration and so forth. But then there's also other instances where the hamstring strain might happen where they're in an awkward position near the boards, and then someone might land on top of them and they might bend forward or their leg might stick out. That would be more of like a traumatic or a contact related hamstring injury rather than something that, as you know, in track and field, that happens on the track.
So, um, like I know that like when it comes to like hockey, you're gonna have like what's the name? The blades? Is it called the blades?
Yeah, the skates, the
Oh
blades.
yeah. Sorry. So
That's okay.
so when they're on the skates and when they play hockey, the way they change or like the way they change of direction or the detail is a lot different with like team sport. So um from like a performance standpoint or like from rehab standpoint, would you program it differently?
Program which specifically?
Like change of direction
Um,
or decel?
I think I'm not, I can't say that there's a lot. So let me preface it with um my roles now is not to program training for the athletes specifically. It would be to support the people programming the training. Um, and I'm not sure I can answer myself confidently because a lot has changed over the years in terms of um, the amount of information that we know that athletes go through. So, whether it be testing and monitoring and so on and so forth, I've been busier on the quote unquote medical side and therapy side, that in terms of the differences between programming of like a soccer player and a hockey player, I wouldn't be able to give you specifics. Having said that, uh, what I do know is that a sound training program for a hockey player, it shouldn't look too different than a soccer player or a rugby player. with regards to change in direction. There's a lot of time spent working on the different qualities of the strength curve, for example. At least with the guys I'm around, there's a lot of time spent on, you know, whether to simplify eccentrics, isometrics, with different modalities like whether it be in the squat rack or with pulleys, um, with flywheels, and so on and so forth. So uh, at the same time, there's also training in the gym or on the turf, and then there's training change of direction on the ice. So it's a matter of understanding that yes, you might be doing that within the gym, but the skills coaches and the strength coaches still have to collaborate with respect to what are they going to do on the ice, and then at the same time you have uh, current means these days such as catapult, for example, to identify, okay, well, this individual has done X amount change of direction work, um, X amount going one way, X amount going the other way. So I would say that's kind of out of my skill set right now.
Cool. So, uh, when like hockey is basically like rotational. Like there's a lot of like you have to like hit the goal. So there's a lot of like rotation. So in your side, how would you treat those like asymmetry?
I think first of all, nobody looks like an anatomy textbook, right? That's number one. Um, and then number two is depending on which way they shoot, whether they shoot right or they shoot left. Um, there are common tendencies that an athlete might have with respect to, for example, thoracic rotation or hip rotation. Um, I think our approach to it should be treat everybody individually, treat everybody individually, yet at the same time, do recognize tendencies between different players, recognize that the position they play might influence on it, play on the team might influence it, the way they shoot might influence it, and then correlate all of that with the testing that we might do, as well as what the joints, for example, look like on the table. So when you put all those pieces together, what is the best approach for our athlete at that given moment in time based on what they're presenting with?
Would you do some corrective exercise for them?
Yeah, absolutely. I think if I feel that their capacity is limited, their physical capacity is limited, that their range of motion, for example, is smaller than it should be, and I feel like we need to expand that capacity with range of motion, active range of motion, passive range of motion, uh, then I absolutely would use correctives. I might use some manual therapies at first, depending on what I'm feeling. Uh, but at the end of the day, they have to be able to own that that range in order for them to control it.
So, uh, in the way I learned like corrective exercise, you have to like do some myofascial release or like some manual work, and after that, uh, the athlete or the clients need to do like some corrective exercise so they're able to maintain it. So, uh, from your experience, um, is like after like the manual therapy or like after uh mm, myofascial release, do you think like some in or in what situation do you think that corrective exercise is needed, and in what situation you don't think that like probably they don't need to do these kind of stuff and they're able to maintain it?
I would say we should flip it around a little bit. My standpoint, my thought process at the current moment is sometimes you might not need manual therapy, okay? Sometimes. And that the exercise might do its job. And then other times, sometimes you need it to open up a window of opportunity for that exercise to do its job. So there's been many times where I've always done the manual therapy, then the exercise. But then there's also been times where I went straight to the exercise and that did the job, right? So, even though I use my hands a lot, I'm gonna say that there are times where we don't need it.
So, but I know athlete love to do like manual therapy. So, um,
Yeah, for
if
sure.
yeah,
That's
so
important. That's important to if they feel that they really like it, a lot of times as long as we know what we're doing, we give them what they need. Give them what they want.
nice, nice. So, um, like so if let's say if they only do like corrective, if they do like some sort of exercise, how long would you take, or how long would it take for athlete to maintain it? Is it like 3 weeks or like
Ooh, that's a good question. I don't like giving timelines because I think the more accurate we are with the exercise, the quicker it should be, right? So if I'm giving someone some things to work on and I don't see progress tomorrow or a few days from now and they're really doing the work that they should be doing and they're doing it correctly, then I have to scratch my head and say, okay, what should I be doing differently? So it's not so much I'm going to give you this, you work on it for 3 weeks, 5 weeks, 8 weeks, and then cross my fingers and hope for the best. It's more of always, always reassessing, reevaluating the interventions that I've given to see if it's doing their job. And if they're not, figure out, well, what can I be doing better? As long as they're doing their job. Because a lot of times people will blame the athlete, but I would say blame myself first.
I love the mindset. I love the mindset. So, um, as a strength coach or as a performance coach, I learned like testing or screening like FMS, SFMA, these kind
Sure.
of stuff. So, uh, is there like there's probably a different screening method or like different like different ways to evaluate how athlete move. Is there any like method or like system you prefer right now, or like you kind of created your own way to like assess athlete?
I'd say at this point in time, um, my system, number one, would be based on the athlete in front of me. So depending on what is going on with them, that will dictate how I will assess them. Having said that, I think all those systems are important to really make sure that the foundation of knowledge that we have is as wide as possible. So each system is a step that we take to better understanding of how athletes might move, might function, and so on and so forth. So whether it be FMS, SFMA, DNS, or any of the other systems, I think the more we expose ourselves to them all, the more we study them and not just take the course, and then actually practice them and troubleshoot them, um, the more we'll realize that a lot of them have uh, common principles. And then we figure out what those common principles are, how they relate to our current understanding of the human body and how humans function, and then we then spit it out based on that blender of what we think the athlete might need.
Well, so um like now how long would it take to like, let's say if an athlete have some like issue with his hip, tightness in his hamstring, how long would it take for you right now to like to find out where exactly is the problem that causing this soreness or the pain from that?
Oh, 2 seconds.
Two
I'm just kidding. No, I'm kidding. I'm kidding. Absolutely not. Uh, it depends. Uh, it might take a few days. It might take within an hour. Everybody's different. Some people have long-standing injuries that and are, we're all complex organisms, right? So the reality is some athletes you might nail it down to one thing, and that one thing might not even be with respect to specifically something in the body. It might be something that they told you that they're what they're doing, right? Or it might be something that they show you when they're doing it. So um, I think it's important for us to be very open-minded, and we need to listen, we need to watch, we need to be available for them to give us the clues. So I would say, you try, and when you assess someone, yeah, the assessment might be, I don't know, an hour or whatever, but it also might be 2 hours and it might be 3 hours, and it might take days for you to really find out what they need. Because once you find out what they need, that might lead you to something else. Or while you're examining, while you're assessing, you might find other things, right? So I don't think if someone says they can tell you right away, I'm not so sure about that. Uh, I think everybody's different. We're we're complex organisms, and I think we have to use all of our senses to be able to help the person in front of us.
Cool. So, um, for all those years of like experience, and now you're working with professional athlete. So, what do you like? In your standpoint, like, what do you think like what it takes to like for like performance coaches or like PT to work in like pro setting?
Number one, be a good person. That's number one. Number two, be available and work hard. And this is not in particular order, but yeah. So it's be a good person, be available and work hard, be curious, be curious, um, be open minded. And when I say, a lot of people say they're open minded, but like when I mean open minded, I mean, we can learn from anything. We can learn therapy from restaurant chefs. We can learn them from musicians. We can learn principles from people who build houses, right? There's a lot of things out there that if we just quiet our minds sometimes and be open and be receptive, uh, that we'll learn a lot. Um, and then, you know, study. And then I would say also another, this is not the last thing because there's many things, uh, is learn from other people. I think the trend these days is as soon as someone gets their certification or their degree, they're the expert. No, you're just getting started, right? So it's, you know, shadow people, ask people questions, um, sometimes pester people, you know, take people to coffee, take people to lunch. Um, you know, even right now I'm 45 and it's like, you know, I just posted on my story today that like I'm inspired by my cousin who's I don't know how old he is. He's maybe um let's say 9 years, no, 7 years younger than me. And he's doing a lot of stuff and it's like, huh, that would be perfect for grip work. That would be perfect for core stuff, shoulder stuff, and so on and so forth. And you know what it is? It's aerial work. It's the people like the stuff that people use in the Cirque du Soleil, right? So I'm indirectly learning from my cousin who has nothing to do with sports therapy, who's 7 years younger than I am. And I'm gonna then learn that and take it to my athletes, right? So, um, yeah, I think but the number one thing is be a good person, know how to communicate, and you can't just theoretically know how to communicate. You have to communicate with lots of different people, whether it be young children and older individuals. I think the best thing that someone can do, um, even let's say for example they're in school right now, is to work customer service. Because if they're working customer service, then they will be able to relate with people a lot better. Because you can't just be book smart. No one's going to listen to you, and you'll have a hard time chatting. Have a hard time communicating with the athletes.
Did you work customer service before?
Oh, I worked at McDonald's when I was 16. Yeah, I worked at McDonald's when I was 16. I worked at the Sports Authority. I worked at other sports stores. My parents used to have stores that I worked at. So I'm not saying I'm an expert in communication, uh, but it did help me before I did personal training, before I did strength and conditioning, and now before I did sports medicine.
Yeah, that kind of like related to the next question I want to ask. So in in this situation or like in like I w- I worked before like a high school or like pro setting in Asia, it's kind of hard for like um strength and conditioning coach to like communicate with PT because they have different background.
Hmm.
So I also have it's also difficult to like communicate with coaches, like head coaches, skill coaches. So uh like for like all those years of experience, what it takes to like besides like working in like customer service, what do you think that it takes to like help like no matter coaches or like PT to communicate with each other since they have different background?
Yeah, I think number one is listening. Like, whether it be while you're working or if you're hanging out with friends or you're somewhere out and about, there are some people that when you're talking to them, when you're communicating with them, it's just a one-way street. They're the ones doing all the talking, right? I think no matter what profession we're in, we can't be doing that. We can't, if I'm talking to you, we can't face to face. I can't be spending the entire conversation me talking. I have to ask you questions. Then you ask me questions. And it's like a dance. It goes back and forth, right? If in ballroom dancing, you're kind of feeling what the other person is doing, so then you react and respond accordingly, right? So same thing with regardless of whatever professions we're in, it's that communication piece of a two-way street, listening and then responding, then asking a question, and then back and forth. And I would say, if anything, it's probably better to ask more questions than to give more answers.
Nice. Nice. I love that. I love that. So, that's kind of like all the question I have for you today. So for those who
Yeah.
are interested in what we're talking about, where can they reach out to you?
Oh, they can reach out to me anywhere. Like I think most of my handles are the same, Jeff Cubos. So at Jeff Cubos, Cubos. Um, I would say I'm I try to be as open as possible. Sometimes, as you know, it takes long for me to respond, and so I'm really sorry. But at the same time, I welcome anybody.
Thank you, man. Thank you.
Yeah, thank you.